Living podcast. As always, I'm board certified internal medicine physician, Dr. Hernando Carter. Yes, your primary care extraordinaire. And this is another prescription for Better Living podcast episode where our goal is to discuss all things health and wellness in a hip and relatable way. Again, our objective is to promote healthy, happy, long lives in our community. This is episode 20. Welcome to episode 20. Can you believe we've been doing this for 20 weeks? Thank you to all of you who've been joining us week after week. And to all of our new subscribers, welcome to the PBL family. As always, you know what I need you to do. I need you to subscribe to the channel. I need you to like the video. I need you to comment on the video. I need you to share it everywhere you go. Stand to the highest mountaintop and scream to the top of your lungs, hallelujah, Dr. Carter is here. Again, remember, we told you that if you want to support what we're doing with the Prescription for Better Living podcast, there are a couple of ways you can do that. Now, listen, this podcast, this YouTube channel will always be free because our objective is to drive down health disparities, promote health equity. This is our mission. This is our ministry. But remember, I told you that none of this stuff is free, right? It's right now coming out of our pocket. So if you want to just help lighten the load a little bit and maybe make things a little easier for me at home, there are a few ways you can help support the podcast. One way you can do it is by joining our Patreon community. You can do that by going to www.patreon.com/Dr. Hernando Carter, DrHernando Carter. That's $5 per month subscription. Well, what do you get for that? You get behind the scenes footage of us recording the podcast. So you don't just see the finished product, you get to see the setup. We have conversation while we're setting up. Not only that, because you're seeing the behind the scenes recording of the podcast, you're actually getting to see and hear the podcast before everyone else. Days, maybe sometimes weeks before everyone else. So that's one perk, and I think that's a good value. But also, you'll get more engagement with me. We'll be having wellness calls where we talk as a community about individual and collective wellness goals, support one another. Now, I'm not acting in the capacity of your primary care physician at that time because, again, this is all just service and outreach, right? But to be able to have access to me to help you with your personal health goals, I think, again, is another value add. And then as we go on, there'll be more things that we'll be able to do. I have an assistant and a team of people that'll be willing to help me. And so we're going to make it worth your while. But if Patreon's not your thing, or if you want to do Patreon plus something else, do you have a business? Do you have a product? Do you have something that you want to promote? Well, you can be a sponsor of the podcast. And if you're interested in that, you can email us at contact@rxforbetterliving.org. That's contact, CONTACT, at RX, the number 4, betterliving.org. You see the Patreon link there on the screen. You see the email. Use it. Let's get into this, y'all. So this is episode 20. We got kind of heavy and kind of deep last week talking about the Tuskegee syphilis study. And Gary and I were talking, and I told him that I didn't realize that we had gone almost an hour on last week's episode because typically my goal is to keep it at around or below 30 minutes. But he just let me go because he could see that I was in the spirit, I was in the zone, and I had to get that on up out of me. And so my plan for this week's episode was to continue discussing medical experimentation and to discuss something that I alluded to in previous episodes about medical experimentation on enslaved women. And we were going to get into that story. But sometimes you have to take a detour and you got to kind of go where you're led. Now, we're going to take a detour today, but it is still applicable to what we're talking about. But I was all set to talk about the mothers of gynecology, and then I received this letter from UAB, the University of Alabama at Birmingham, and I want to read this letter to you. Dear Doctors Carter, thank you for your support of UAB through the B-Men Achievement Endowed Scholarship. Your generosity provides much needed financial assistance to students so they can focus on their education and career objectives. In response to a changing landscape, we have to reconsider the criteria for membership in organizations to ensure we are in compliance with applicable law. We cannot limit membership to a particular race, gender, or similar protected class, which means the Blazer Male Excellence Network is unable to continue. UAB took the opportunity to create the Blazer Mentoring Collective to assist students who might not have a strong support system or access to valuable resources. Students who meet the following criteria are invited to participate in the Blazer Mentoring Collective: Pell Grant eligible, low socioeconomic status, academically unprepared for college studies, and or low ACT, SAT test scores or test optional. In addition, we cannot limit scholarship decisions to a particular race, gender, or similar protected class, but we can agree that all applicants will be considered. Accordingly, moving forward, the scholarship will be awarded to students who actively participate in the Blazer Mentoring Collective and meet the additional criteria as outlined in the scholarship guidelines. If for any reason you do not agree with the administration of this fund, please contact me by October 14th, 2024, either by email, and it gives their email, or phone, and it gives their phone. Office of Advancement. So, let me tell you why I decided to take a detour after getting this letter. Remember when we were talking about health disparities, and we talked about the way simplistically you can understand a health disparity is when you control for all other factors being equal, you can put two individuals side by side. They can have the same level of education, they can have the same level of income, they can have the same zip code, but one is black and one is white. Odds are the person who's black gonna have poor health care outcomes than the person who's white. That is a health disparity. And our society is just flooded with health disparity. I see it every day in terms of what I do. But remember that we said that there was a study done that showed that when you paired a black patient with a black physician, their health outcomes were better. They were more likely to accept the preventative services that were offered, be it vaccination or cancer screening or other health screenings. And we said, well, why is that? We talked about and we got into the mistrust that exists in our community for the medical industrial complex. It's just baked in. And where we had started to go before I got this letter was to just give a history of that and explaining why. Remember, I said that the Tuskegee syphilis study ended in 1972. I was born in 1979. So we're not talking about ancient history. We're talking about 7 years before I was born. So my parents, my grandparents, my aunts, my uncles were still alive before the Tuskegee syphilis experiment ended. And so there's a mistrust that's baked in. And that's just one example. But there are many examples. Okay. And we said that if we want to begin to really tackle this health care disparity problem, is going to take a multifaceted approach for sure. But one of those approaches has to involve increasing the number of Black healthcare providers that graduate year over year. According to the American Medical Association, the graduating class of medical students each year has about 10% of its graduating class that are Black. That equates to about 500 to 600 Black physicians each year that are graduating. It's a drop in the bucket. That's not enough. And so one of the ways that we have to level the playing field is by creating an environment that is more welcoming, that is more inclusive, and that is more diverse. One thing I know about diversity is that you won't have it if you're not intentional about it. And that can be on either side. Wherever you have a dominant race, and by dominant, I just mean majority, whether it's an all white environment, an all Black environment, an all Asian environment, if you want that body to be more diverse, you have to be intentional in your efforts to promote diversity. What does that look like? I'm glad you asked. You have to go where the diverse people are. If you're at an all white or a majority white environment and you want to bring in more Black people, you go to the HBCUs, you go to those high schools that have a larger concentration or population of those individuals. If you are at a majority Black environment and you want to be intentional about diversity, then you recruit in those areas that have a larger concentration of the opposite race. Now, here's where we get off track. We get off track because individuals say that promoting diversity equals lessening standards. And they also say that promoting diversity happens at someone else's expense. In other words, it's a zero-sum game. So that if you recruit and are intentional about having John Doe black, then John Q white loses because they say it's a zero-sum game. But we all know that that's not how life works, and that's not how the world works. Again, they also say that being intentional about diversity means that you have to lower the standards of your institution, and that is insulting. I can remember being a first-year medical student at the gross anatomy table and having classmates of mine literally question how I was accepted to my medical school class over some of their friends who applied and didn't get in. Simply because I was black and I graduated from an HBCU, the assumption was that I was less qualified than their white counterparts. Granted, they didn't know what my medical college admission test scores were. They didn't know what my grade point average was. It was just the assumption that because I was there as a black person in a majority white environment, an exception had been made for me. The standards had been lowered. Now, mind you, not only was I accepted to this majority white medical school, I was also accepted to two historically black medical schools, Meharry Medical College and Howard University School of Medicine. I chose to go to the medical school that I went to because I'm from the state. I had a connection there. Heck, I was born at the hospital. My family was there. My mother was there. My father was still living at the time he was there. I had a baby sister who was maybe in the third grade, I don't know, elementary school. And I wanted to be back near my family, and I had every intention on staying in Alabama and building my practice and my life in Alabama. So that's why I chose. But the sentiment has always existed that if you are intentional about having a diverse population in your organization, then somehow you lose something by doing that. The implication is that the people of color are less than. That is the implication. It is not explicitly stated, but is there under the surface. So in 2020, then President Donald Trump released an executive order entitled Executive Order on Combating Race and Sex Stereotyping, which barred government agencies and contractors, including the armed forces, from promoting, quote, race or sex stereotyping or scapegoating. So that was the start of what has now become a chain reaction. In 2024, our state passed Act of Alabama 2024-34. And Act of Alabama 2024-34 is an Alabama law passed during the 2024 legislative session, which prohibits certain public entities from operating diversity, equity, and inclusion programs or promoting divisive concepts, and requires public colleges to designate restrooms on the basis of biological sex. That was passed. The gentleman who is responsible for getting this legislation through is a lobbyist named Earl Tilford, who has a 501c4 social welfare nonprofit called Alabamians for Academic Excellence and Integrity. And he promoted beliefs that DEI programs were a cover for radical left-wing policy. So in the spring of 2023, Alabama legislators asked Alabama public college administrators to identify all funds or expenditures for their diversity, equity, and inclusion efforts. And most of these efforts, according to an analysis, were actually federally mandated. And so on March 19th, our governor signed this act into law, and the law is scheduled to go into effect October 1st, 2024. And what we've seen since the passage of this law is the closure of diversity, equity, and inclusion offices at the University of Alabama at Birmingham, at the University of Alabama, at Auburn University, at any public college university here in this state. So what about this letter from the Office of Advancement really got me going? Well, B-Men, as we affectionately call it, the Blazer Male Excellence Network, was a community. It was a safe space for Black men in college at UAB. Black men who are still in the minority in most colleges around this country. And it was founded in order to make sure that these young men could successfully matriculate through the university and graduate. Intentionality. Because those who birthed the program understood that being isolated in a majority environment when you're a minority can adversely impact your academic success, could adversely impact your mental well-being, your physical well-being. And so what you had was a great experiment that really could have and should have been replicated all around this country. You had peer-to-peer mentoring. You had upperclassmen who were mentoring underclassmen. That was giving these upperclassmen valuable leadership experience. You had professors and administrators in the college and university who had a vested interest in these young men, who brought in resources from the community, resources like me, who did not graduate as an undergraduate from the University of Alabama at Birmingham, but as a graduate of Morehouse College, I understood what community and what mentoring, even peer-to-peer mentoring, can do for a young man. Some of these young men who had come from broken homes, troubled backgrounds, not all. Heck, some of them could have been like my sons. Two-parent household, well-to-do family, middle class, but still need guidance and mentoring and need a safe space, need somebody to look out for them. There were academic standards that were set. They got valuable life and career coaching, from how to do resumes to the proper way to tie ties and business attire. And there were some culturally appropriate things like rites of passage, which is very important in our community. And at the end, those who shined, those who had exceptional performance could get scholarships. I had a mentee of mine who's now in medical school, who was a part of the Blazer Male Excellence Network. And you know where he is right now? He's in medical school at Yale University getting his MD, PhD. But he's not unique. This program is gone. And I don't care how they try to slice it. The Blazer Mentoring Collective will not have the intentionality that the Blazer Male Excellence Network had. This program is dead. And we, as a state, are not better for it. UAB, as an institution, is not better for it. The shuttering of diversity, equity, and inclusion offices all around this state does not benefit this state. It harms this state and places the future of this state at a disadvantage. Point, period, and blank. It's not just in the state of Alabama, but it does seem to follow a particular regional pattern, and I wonder why. Florida, North Dakota, South Dakota, Tennessee, Texas, Utah, just to name a few. I was talking to a colleague who's a graduate of Duke University, and the alumni of Duke University endowed a scholarship for talented African-American students who were accepted to Duke University. And they were told that that scholarship could not go to the individuals that those funds were intended to be given to because of anti-diversity, equity, and inclusion laws. Millions of dollars gonna be returned. And then let's talk about this divisive topics. The divisive topics that they are talking about could be topics like we discussed with the Tuskegee syphilis study. They would consider that a divisive topic. That's history. It happened in our country. So if we don't wake up, y'all, and if we don't figure out a way to do this for ourselves, a way to take our funds and put them into private foundations so they can go towards the intentionality of diversity. If we don't do that, it's game, set, match for us, baby. Because there are forces out here that really don't want diversity. They don't give a damn about equity. And they don't care if you include it or not. And they will erase the entire history of this country. And those who do not know their history are doomed to repeat it. So, this has been another episode of the Prescription for Better Living podcast. As always, I'm Dr. Hernando Carter, your board-certified internal medicine physician. Yeah, I'm still your primary care extraordinaire. Asking you to, hey, comment on the video, like and share the video. But whatever you do, scream from the tallest mountaintop you can. Hallelujah, Dr. Carter is here. Until next time, Dr. Carter saying, peace.